Hi, Karen. This is my colleague, Karen
Hey.
Brown, who's the clinical director for Seeking Integrity. I'm so grateful to have her joining me. We've done ladies' night before, and so we're doing it again, but we have a fair amount of recovery experience, but she's also actually really a great clinician. So she can answer from a clinical standpoint too. So, but yeah, Dr. Rob was unable to be here tonight. And so I asked Karen to join, and she graciously accepted. So after a very busy day of working with the clients who are in the Seeking Integrity Seeking Integrity treatment program. So I've had a busy day, so I apologize. We're glad you're here. I'm going to start asking the questions, and you remember you can follow along with a Q&A. So, okay. What are your thoughts on paraphilias that started from youth and were always a secret that eventually became a foundation for sex addiction? The paraphilia has mostly been linked to masturbation. What will this look like in a healthy recovery? The addict does not have any interest in the paraphilia with his partner, but his addiction has mostly been acting out alone. And then there's a separate question, but I think they're separate. So let's start with that one. So what are your thoughts on that?
I'm not seeing any questions on my system.
Oh, you know what? I'm going to hit, so I'm sorry, because you joined a little bit later. So check the answered one, click answered, and I transferred it to the answered, and you should be able to see it now.
Okay.
I do this for Dr. Rob all the time, because
there you go.
it takes a bit to catch up. So
there you go. Okay, so paraphilia started from youth, or the secret foundation of sex addiction. Also belonging to masturbation. All this like in healthy recovery. That's not an interest in paraphilia with his partner, but it's also addiction. Well, one of the things that I would ask is what type of behavior is going on. When we say paraphilia, that could cover a lot of different areas. If it's behavior that could create a problem with another person by any type of illegal things or touching or things such as that, or they want to do any type of suit or anything against it. So sort of like it depends on what it is that's going on. Can it start in childhood? Of course it can. I see a lot of people, a lot of men, a lot of times that have issues around mom and something that's going on and how mom may have dressed or not dressed when they were young. And so they start to, look at things and sneak around and do different types of things. It's linked to masturbation, so it could be fantasy related when they see someone, like a leg, a foot, an arm, or whatever it is, and then they go into fantasy world and masturbate based off what they're seeing. Can it impact your recovery? It can, in case it escalates. But we do work with all of this in terms of what behaviors need to be in your recovery circle. What behaviors, and that would be one, especially if it's something that's causing a problem in a relationship or an intimate relationship or marriage or a partnership, is that the same type of teaching, training, learning, and understanding is there. So how do you stop when you want to go there? There's always a choice in recovery, and it's not an excuse to not be in recovery, but it just means there's more practice that's involved, more awareness, and how do you stop yourself when you know it's starting up? Do you agree with that, Tami?
Well, yeah, and it was like has been mostly linked with masturbation. It's not part of the sexual play with a partner. What does this look like in healthy recovery? Like, and I think it really does need to be unpacked with a qualified professional. But if it's highly linked to the acting out, it's a solo thing, and it's got nothing to, that does not feel like it has anything to do with recovery if it's not about, being part of a nurturing relationship, going forward. That would be, to me, just reading this, inner circle behavior that would be part of not okay for my recovery, particularly if it goes, like you said, to the fantasy. And so then what else is going on? Where does that move my headspace? So even if I don't act out, where's my headspace? And just being in the, in that chaos is not good for my recovery. So to protect my recovery at all costs is, so like if I have to give up doing something, if it's on the template, it's always going to be on the arousal template of like, okay, I'm always going to be attracted to that. But as Karen said, doesn't mean I have to act out. I have a choice on, what I choose to do with my actions versus, a fleeting thought, that I might have. So,
Exactly.
okay. I put the next one in the answered as well. If a CSAT says you are borderline for inpatient treatment, so not borderline personality, but on the edge of like, I might need inpatient, would you recommend going straight into inpatient? If so, how do you choose the program and why? Well, for males, it's seekingintegrity.com is the most expert. But anyway, okay, let's start with if you're on the cusp of like, could go to inpatient, don't necessarily need inpatient. I have thoughts. What are your thoughts?
My thoughts is if the CSAT did say that it's borderline for patient in treatment patient, then I would go with that recommendation, because any type of addictive pattern and behavior is going to escalate. Unless you're in recovery, there's the next step that somebody would go to. And we see that all the time. It's like, well, 6 months ago or a year ago, this is what I was doing. And then it changed. And I don't know why, or there was an event or something that happened or something mental health wise. And then they escalate, and they will escalate to the next step. So if somebody really is interested in whatever the treatment looks like, whatever they need to have, then I would recommend that they follow what their CSAT is telling them and not wait until it takes over your life, it takes over your family, it takes over your money, it takes over everything there is, and to really seek the treatment and be open to it. So Tammy, you want to talk about the treatment?
I do, because I think if you have the opportunity to get qualified help in a compressed time frame, which is what we offer at Seeking Integrity, is expert treatment in a compressed time frame. You get such a great foundation of recovery on which to build. And so rather than continuing to dance around, we have guys that come to us all the time, and I go, if you had come 6 months ago, just think of the negative consequences that you wouldn't have had to experience. So getting the best help to get a foundation the quickest, is a gift if you're able to do that. Now, do you have to go to residential treatment? No, but I always say, if you are applying as much energy to your recovery as you did to your addiction, including the time you were in fantasy and thinking about it and everything else. So like, it's a lot of time every day that you can be focusing on recovery. So you've got a qualified therapist, like a CSAT trained therapist that you're working with, ideally at least individual and group once a week, maybe twice a week. You're going to our drop-in groups on the sexandrelationshiphealing.com site where you found this webinar. If you're joining live, the 12-step has a variety, working with a sponsor, actually doing the steps, not just checking in a meeting. Meetings are great, but it's doing the steps. So I mean, that's a process, and you can get a solid foundation of recovery. From what I've experienced, I think it's probably like a 12 to 18-month period of time, sometimes a little bit longer, to get a really solid foundation. But if you're really engaging in that, you can compress it a little bit. So for many people, including partners, having a shorter time to get qualified help is good. There are many options, and a 3-day intensive is very different. And many of them are workshops. And a workshop, we have online work groups on seekingintegrity.com. That is not treatment or therapy. It's psychoeducation, which is a great supplement to working with your therapist. They're great, but they're not treatment. They're not therapy. The guys that come to us have 4 to 5 hours of assessment before they even arrive, because the acting out is a symptom of what's really going on. We want to stop the behavior, of course, but address those underlying issues. So it isn't just switching to another form of acting out or relapse, which is painful to them and to partners and families as well. So
One of the things we see in our workshops that we have is if somebody is, they're not really sure, they're hesitating and they're not really sure, do I want to commit to an inpatient treatment program, is they'll go through a workshop and or work groups like the ones that we have and go through those and get some knowledge and information. They get the connection of other human beings that are having similar problems with them. And then we'll get the phone call that says, okay, I'm just going to do another group, or I really think I need to come in, because more knowledge and information is passed on so that the client can determine, do I need to go in or do I not need to go in? And they get support around making those type of decisions, as well as having their CSAT involved if they choose to.
And we have some online quick assessments. They're not anything like what we use, for the people coming to us on the seekingintegrity.com site. And you can, go get a, kind of a beat on where you're at with things. But I do find, and the facilitators for all the work groups, are there to help guide you too. If you, talk to them and have a question or something, they can help guide you. We have 25 and 50 minutes support sessions that, often people are coming and going, I don't even know where to start. And we'll do our best to help, give you some options and lots, like I said, lots of free resources on the sexandrelationshiphealing.com site, low cost work groups on seeking integrity, and then expert treatment, for men, only men, at Seeking Integrity treatment program. So
I encourage you to remember that it's only or only the person knows where they really are. Are they telling the truth? Are they sort of minimizing things or rationalizing behavior, which is very common for any type of behavior like that. So it may be, don't go inpatient right now and do a workshop and figure out, do you fit? Are you a person that can connect with some other people? Are you scared to do that? Or you can't get away right now? See if you are matching up with what they're teaching. And if they are, and that's what you realize, then seek treatment and help, because I see it destroy lives and families. So, but if you need time to figure that out, since the therapist says borderline for inpatient, that's sort of a warning sign to me. As a therapist, if I said that would be, okay, you haven't crossed a boundary that you can't return from, but there's something
you're on the edge. Yeah.
They're on the edge of that cliff and I don't want to fall off of it.
Yeah. And honestly, I hear too often of people that waited and loss of a relationship, loss of a job, legal consequences. I mean, there's stuff that happens that had you gotten help 6 months or a year ago, what, could have disrupted that whole freight train going down the tracks. So,
and the last comment I want to make is, remember this. It's most common to say, well, I'm not as bad off in this as that person is. And then it's like, well, but what my last word would be, yet, because it does escalate.
Mm-hmm. And be grateful yet, but but it will. Okay. My husband has recently begun working with a sponsor, but is reluctant to do his first step. He feels there is nothing to be gained by rehashing past behavior. Can you speak to why this is important for him?
Okay, can't see that one, Tammy.
It's in the answered too. I put it in the answered.
Oh, all right, I'm sorry.
I'm going to keep moving them to the answered, so you just know where to look. So you just stay there. So
I'm gonna stay here. I'll stay on my side of the fence. How about that? Reluctant to do the first step. Well, the first step is about powerlessness and surrender and all of those kind of things. So being reluctant, I'm surprised that your sponsor has not said, you've got to start a first step to at least identify what's going on and how your behavior takes control. And you have no more control, even though you feel like you do. There's nothing to be regained or rehashed by past behaviors. Yes, there is. If we can identify a pattern of behavior, triggers, or any type of resentments or things like that, or events in lifetime that has started a process to occur, we want to know that. We want to know how these things are overlapping with one another and how they're making you continue to move down the road, which is not a good road to be going down. So it is important to look at it. It is important to eventually decide if you want to be in recovery or not. And 12-step is the most amazing way to, once you're in recovery, to stay there and have people to support you. So rehashing, no, I would call that avoidance or denial versus just, I don't want to go back and look at anything that I've done.
And I almost wonder if it's the fourth step, because that feels like, this feels like a fourth
Yeah.
step issue. So, you know, where fourth step is took a fearless and we have to take a fearless moral inventory of ourselves, fearless and searching moral inventory of ourselves. And it's challenging, but it's the most freeing thing. And the people that I see go, oh, I don't want to do that, I'm scared of doing that, or whatever, are the people that don't ever really get recovery. They may stay abstinent, they're miserable, they're like a dry drunk, and they relapse. They're highly prone to relapsing. You know, when I go to
Right.
meetings, you go, okay, they're stuck, and then you don't see them at meetings for a while, and then they might get to come back, but you know, so you don't get the benefits of recovery. So when I was early in recovery, I heard the elevator to recovery is broken. Please use the steps, and that was really helpful for me to remember.
Right. Yeah.
I learned a lot of those little things, and it was just like, I have to use the steps and I have to do the steps. Just warming a seat in a meeting does not give me recovery and keeps me from acting out that moment, you know, for that hour that I'm there. But you know, it won't give me the freedom that you get. Like, there's promises read in the 12 step. You have to do the work in order to get the promises, but they do come true. Like
They do.
we don't have to live with the shame. We don't have to live with the guilt. We don't have to go, oh, I'm so bad at rehashing. You know, or we will not regret the past nor wish to shut the door on it. That's one of the promises. We don't have to live like that. So, okay, I'm answering.
I would suggest that he listen to his sponsor.
And everybody gets to choose, but you can either live in recovery or you can, you know, straddle the fence.
There you
It's painful, but I'm 23 weeks pregnant and we are separated. And when I talk to my PASA husband, he blames me for his AO over it was AO over the past few years, acting out. Sorry. First D-Day was this October, trickle D-Days and retraction since. He can't talk to me without mentioning that I have problems. Is this normal for SAs, the constant blaming?
Absolutely, it's normal. This is, you know, if I blame you and then I'm trying to redirect in many cases, I put everything on you as a spouse or partner, and it keeps the wall up for me so that I can deflect and not look at the stuff that I need to look at so that I can stay in recovery. Having disclosure or D-Days or discovery days over and over and over again is just ripping apart a relationship, because how do you know when you can trust them? You know, if I'm waiting for that next day to come and see what happens again. So it is normal. It is, again, it's part of denial. It's part of, I don't want to do this right now. I want to continue acting out or doing what I'm doing. And I'm not ready to surrender to a process. And again, that's part of, there's not a lot that, I'm sorry that, that you're going through this at this point in time and being pregnant and all of that. But it will make sure, please, that you get help that you need to have to keep you safe, and keep you too safe at this point in time, because it's heart-wrenching, it's stressful, it has everything that you don't need when you're pregnant right now. But acting out and just constant discoveries, well, that means he's still acting out if you keep discovering things and truth is not being put out there.
Yeah, I mean, the blame shifting is in gaslighting. There's nothing you did or didn't do that made him go act out. He chose to do that. So I'm with Karen. What do you need? And it may be that you don't talk to him. I mean, what what is there an intermediary that, if you need to have a message get to and from him, is there a safe way to get that to him without it being you? But if you can set healthy boundaries for you, for your health, for your baby's health, what do you need to do?
Right.
But I know that negative, I mean, that's not good for your health, not good for your baby's health. So, like not talking to him, not, I mean, if he's a suggestion, I say, I want to talk to you. We're going to talk about this. And if we can't stay within this boundary, I'm going to hang up. We'll try again, but as calm as you possibly can, to get centered with you. Lean into other betrayed partners. They're really good at supporting each other. And so that you have support, to help hold the space for you too.
Totally agree. And I have seen many, many clients over and over again that when I first start to see them, they're always going to be blaming the partner. It's not enough this, it's not enough that, you don't do this, you don't do that. And again, that's that whole deflection that's going on, is if I can blame it on somebody else, then it's not about me. And you'll see it in any type of addiction. One of my favorites, from not picking on alcoholics, but I've seen it all the time, or it can be sex addiction, is I'll create an argument. I'll create something and then say it's your fault that I started getting angry and upset. And the fact is, no, that's part of the plan, to be able to escape and act out in some way. But most of the time, once people have started to get help, then they get called on this kind of behavior. And they're saying, look, I don't want to hear what he or she did or does. I need to know what you're doing and how you're going to change. And that's recovery. So I do agree with you. Please take care of yourself.
Yeah.
Please.
And unfortunately, not everybody chooses that. I just was emailing with somebody earlier today, and he blamed her and then left. And they'd been in a long-term relationship. And I was saying the same thing to her. It's not her fault, nothing she did or didn't do. He just wanted an excuse, and it's way more fun to go, it's your fault, and I have to leave you because you're so whatever. No, he had choices. And Eddie Caparucci did a really good webinar last week. I just thought of this, that it was on wedding vows, and it was a really interesting one. And I thought, yeah, when you say I do, it's interesting to go back and read, that I will love and honor you and all of those things, that we promise. And then, in addiction, that, goes out the window. So thinking about, do I want to be true to my word, to my vows, for those in a relationship that is, is a marriage. But it just struck me that, this is not part of loving and honoring, in a relationship. If you're doing things that are secretive and then turning around and blaming the person that really wasn't responsible for it at all. So the person that mentioned about paraphilia is added its textures, including masturbating and panties, mine and my daughters, etc. And I'm sorry, I have a big reaction to, especially your daughters, but even yours. It's like, I mean, if he asked about doing that with your panties, that's one thing I get. If you permit it, don't, but if he's stealing your things, that particularly daughters, that like feels
icky. Yes.
So, and that would be an absolute inner circle for me. So
there you go. So that, I totally agree with what you're saying, Tammy, and I really appreciate this person adding more into it, because it's what else comes after that. I mean, again, permission in a marriage, two consenting adults that agree, okay, whether you're masturbating into my panties, you're wearing my panties, you're doing whatever, if you two are agreed that that's okay, that's one thing. But I would bet in this case, the daughter hasn't agreed that it's okay. And that feels like a violation to me of respect and all of that. So I just wanted to add that in.
I'd be, get your own panties, don't stretch mine out. So. Okay. I wonder what percentage of men, these are always, I have a background in math with statistical emphasis. So when we get into the percentages, I'm always intrigued. I wonder what percentage of men fit into the category of sex addict to one degree or another. what percentage of people who drink a lot and often are alcoholics? Different animals, I know, but point of contrast, real question is the first part. I really wonder. I think it's very simple. I think addiction, and actually to your question, so many people have more than one addiction. So just saying I'm just an alcoholic, I mean, I know very few people that absolutely fit into only one category. There's usually some other compulsive behaviors that sometimes it's like, well, this isn't as bad as that. So I'm not going to drink, but now I'm going to smoke cannabis, nonstop. That happens a lot now that it's been legalized. So I think if there's a compulsive personality, and there's a lot of people that are heavy drinkers or watch porn or whatever, but it's the secrets and lies. And if, you're lying and minimizing, and as that other person shared, blame shifting, gaslighting, you're making me do this and all of that, if it's interrupting your relationship with other people in a real and meaningful way, that's the deal. I read something not too long ago, and I wish I could recall what it was. COVID has been really hard on people. And I have a feeling that some people that might have been in the category of problem drinkers or recreational drug users have stepped over that line. And I do think that there's a line if you kind of get up to that and go, wait, I got a problem. I need to address it. I know lots of people that were heavy drinkers for periods of time, but they weren't alcoholics. I absolutely know that even before I took my first drink, my personality is such that, it wouldn't matter what, I can get addicted to anything. So, no, I really can.
No, I agree. I tell people all the time I could get addicted to a chair if I wanted to, because it's that connection, and I need it and I want it. Remember the words, I want this, I, me. One of the things I want to say to this person is I worked in programs where it was an all male program, and I've worked in all female programs. And I can tell you that part of what I saw is, as from young to old, it doesn't matter in between, but there were so many females that may have sex, love, and relationship addiction issues. And how do you cross the line when you're addicted to relationships? I want to be loved. I want to be needed. I will do anything you want me to do. And so then I'll start acting out sexually with you with the hope that I will get you. It's sort of like that win the prize kind of thing. And the reasons are very similar across the board, but it was very different. And I just think a lot of women are not used to asking for help. There's still a stigma attached that I can't ask for help with this. And I know that I have run female only programs as well. I never run a co-ed program, but females only as well as men only. And I see the same thing in both. A little bit different behaviors, but very similar. And the need for help is very big. So percentage wise, I don't know, Tami,
So I remember this. I remember I was sitting in a treatment center a long time ago, and there were like 20 of us in the group, and the therapist. I mean, I still really remember this. The therapist looked around the room and was like, "Odds are that only one of you will remain sober." And I remember thinking, this is really dear God, nothing against these women, but please let it be me. And I did. And I don't know what happened to the rest of them. I know that for me, I learned enough and I got the right amount of help, and I took it seriously. When I went home from treatment, that night I was in a 12-step meeting, and continued that journey. And I've gotten help from qualified therapists. I've done, individual and group work even after I was in recovery for a while. COVID was hard on me. I went back to my therapist for a bit, because I was like, I just ate that, and she helped me out. I want to not act out. I want to live in serenity as much as I possibly can. And most hours of most days I do. So.
Yeah, I call that a tune-up. Sometimes you just need to be brought in and help put things together. One other comment I want to make is, we have one of the things of Dr. David Fawcett works with us, and he's a well-known name for the term chemsex. So anything that is mood altering like alcohol is mood altering, right? So what his work is about, and much more, is about the fusion where I may have drinks, and then they get more and more and more, and then once I get drunk, then I may be making a phone call to hook up with somebody. Do they occur together? Not always together. I can do one and not do the other, or vice versa, but eventually they move closer together. And that's where you always worry about the fusion of those two behaviors, as well as it's not uncommon that I work with people that they have financial issues that have occurred because they're spending so much money. They're hooked on video games. They're hooked on online gambling. So it's really important
Food,
to go through
sugar.
everything. It's
Yeah.
really important to really look and work with a client or a patient, whoever, whatever they're called, is to see what other types of behaviors are occurring that you're not paying attention to because you're so involved in these other things here. And it was not as common a long time ago to have men that would own up and say, hey, I have an eating disorder. But I've seen many now that will say, I'm overeating, or I'm anorexic, or I'm binging and purging. And I do it because of shame and guilt because I just acted out. And now I've got to do something to my body to hurt me. And then I also have to look good to make sure that somebody wants me. So these two things can totally be fused together. So any of the behaviors can be that way.
And to be happy, joyous, and free, we need to address the underlying issues that cause us to do whatever it is. I call it the garbage can. It's like, well, I can't do that one, but I can't do that. So finding something to numb out, escape, to not make me feel uncomfortable, even good feelings can be uncomfortable. So like just looking for anything, vegging out, it's okay to take a break. We all need mental health breaks, but if you're binge watching, 10 hours of a TV program and not paying attention to the people in your world, that can be a problem. So
exactly.
Okay, next question. What would constitute a borderline inpatient? And I want to keep clarifying, it's not borderline personality disorder. It's just like, hey, you're on the edge of, on the cusp of, I might need, inpatient. What would be the deciding factors in determining inpatient versus outpatient? So I think a lot of what we talked about with like, how fast do you want it? It will get worse. You doing intensity with outside, if you're not doing intensity at inpatient. I always want everybody to have the best shot at getting, a solid foundation of recovery. I just said to somebody earlier today, if we're not your first residential treatment program, we sure want to be your last. We want to help you get that solid foundation and the support, after you leave. I know for sure, going back to, not to overshare, but like when I was in treatment, before I went to treatment, I was like, oh no, I learned my lesson. That was really horrible. I mean, it was really, it was really not good what happened, right before I went off to treatment. But I know for sure, I had plans for like, oh, alcohol is a problem. I did recreational drugs. No, I didn't. But in my mind, I absolutely know for sure that had I not gotten, that level of help, I would have just kept, going around the garbage can addiction. So it gave me enough of the skills to be able to learn to live differently in a compressed amount of time. So I'm grateful.
And to answer this person's question is what would constitute the behavior, I would see a therapist and I would have some assessments run to see where you are. Every human being is different. So something that I may be doing may be able to be handled in an outpatient setting with a CSAT therapist if it's sexual acting out, or with a therapist if it's alcohol or drugs or whatever is going on. But I would see a therapist and have some assessments run and talk to them to see what you need to have, and not make the decision on your own that, oh, I don't need to get any help and I can just stop this myself. It's not really a problem. Again, it's not a problem yet, but you may not know already who's being impacted because of the behaviors that are there. So I don't mean this to the person that asked the question. I'm not sure if it's coming from you and you've got questions, or if it's somebody that you care about and you love. But please seek some advice and some consult around where you are or where that person is in the process. And that would be the best advice I have.
Yeah, and I just put in the chat, and this is not the assessments that Karen is talking about, but it's a quick little self-test. So on the seekingintegrity.com site under the resource tab, you'll see, and I put the direct link in the chat for those of you that are joining live. So
Great.
and at the end it says, if you scored this, then you may whatever. So it's just one determining factor. A CSAT trained therapist has a whole battery of assessments they can and provide for you. At some point, if you're tired of living the way you've been living, there are different ways to live. So either really engage, if you don't go inpatient, or go inpatient and get a foundation and a plan to do things differently. So,
Right.
Okay, next question. Have you ever had any experience with someone who has been all in with Jesus and not had to do a 12-step? I personally can't think of anyone. I don't know if you have any anecdotal.
I know that there are other groups and organizations that are very Christian based
But they were
organizations.
still groups, and like Celebrate Recovery
Right.
is one. But even with that though, they and I don't know this, but they typically meet once a week, and so like that wouldn't have been enough for me. But like to change behaviors that are decades old. But I mean, I just personally don't. That doesn't mean that it doesn't happen. But I'm at a 12-step meeting, so
There you go. And we have people all the time from all beliefs, all faiths, all backgrounds, all everything. And the one thing that I find in common is their behavior. So whether somebody is all in with Jesus or not all in with Jesus is, I would ask the person you're all in with, which is Jesus in this case, as to what's really going on. There's not a wave a wand magical cure. There's got to be work that's done to figure out, identify what I'm doing, and then identify how do I change what I'm doing. And a lot of that occurs by looking at your past and looking at who's been impacted by it and things such as that. So anybody that does not have to do a 12-step, they probably have some type of step type program, because you want to be able to reveal what's going on. You want to be able to be in groups with other human beings so that you can share the shame, the guilt, the sorrow, the anger, all the kind of things that come up that keeps us relapsing. And I'm not talking just a slip, because slips can end up turning into relapses. So that's what I suggest, is look into it.
Well, and the opposite of addiction is healthy attachment. So being in connection with a community, which, if you're biblically based, there was a lot of community, Jesus had disciples, so just saying. So, but it's one of those things where, yeah. Yeah, I know. I've actually thought of that before. It was kind of like, huh. Anyway, but I'm thinking, it's one of those things where, like my best thinking got me to 12-step. But so learning to do things differently. And, Karen mentioned about all the negative things, like, losing the shame and all that. We also experience joy. 12-step, I mean, like the ones I go to, we're laughing. I mean, it's like we're laughing about things. So being able to share good things as well as, the not so good things, the shame reduction and everything is really important. So I needed other people to show me how to do things differently. And that was really key. So.
And we also have a gentleman that works with us that is called a PSAT. And actually he works with the spirituality access of, doesn't have to be an organized thing, or doesn't have to be this or that.
Not religion. Yeah.
Religion based, but to bring things together. And, that could be somebody like him or somebody like that, to have a consult with, and just say, this is what I'm doing. Where should I go? And do I need to do something? And seek consult. Again, all it is a phone call where you can ask somebody what you need to do, or at that point in time, where can you go, or things such as that. And they'll help redirect you to what you need to do.
Yeah. If I could have prayed away my addiction, it would have been long gone. But I honestly felt it was a failure of my praying because, every night I kept doing the same dang thing that I was doing. And so like, it was a horrible problem for me. So I'm way oversharing tonight. So sorry. I may not put this recording up. So we'll see. Okay. I'm talking.
You're telling your truth, Tami. It's all
I
good.
am, and it is. It's part of my history. Like and the 12 step, which is having had a spiritual awakening as the result of these steps. That ended up being my favorite step, and that was like there was a lot of pain. In fact, Jason is working. One of our colleagues is working on a spiritual abuse work group that will be coming out probably second quarter of this year, because we know a lot of people have been hurt by religion and things, and spirituality and higher power is very different than organized religion. So whatever's working for you, like seriously, just sharing here. So take what you need, leave the rest. But we have people of all faiths and no faiths that come to the Seeking Integrity, and that's great. We want to meet you where you're at. We're not shoving anything down anyone's throat. It's
Right.
but we know for sure that the addiction, the pain of the addiction, the lies, that's just hurtful, to all of us. And we don't have serenity, we don't have peace, we don't have integrity, but we can learn. So
All of that means if you don't have any of those kind of things, then something's going to fall apart and you'll be miserable. And I don't intend on being on this earth and being miserable all the time, because I am an addict in recovery for many different things, because I kept trying to find, okay, well, they said that's an addiction. So what about this? And then they'll go, that's an addiction. It's like, darn, I mean, is there nothing that's not an addiction? But I had to get to my trauma, the root of my world, the things that I was telling, the negative core beliefs that I was telling myself about me, before I could finally understand that I don't have to medicate. I don't have to run away. I can be me and be accepted and loved for who I am. So that's a little of my share, Tami.
thank you.
You're welcome.
So the next question, I'm taking the Men's Porn Addiction 101 workshop that's on the Seeking Integrity site, and stress and workaholism were a huge trigger for me, and it is still causing me marital issues as we are trying to conceive, and I am not interested in sex enough. She still brings up my acting out 2 years ago during fights. She still brings up my acting out. Oh, that's in there. I'm wondering if workaholism has become worse after sobriety, and do I also need a separate plan to work on it? It is less interested in sex because of not acting out. I'm still working on getting better intimacy and better physical health for myself. That's a lot, but thank you for sharing. So
that's a lot. So I'm not sure if the question on here, did I see anything about doing the workshop?
I'm wondering if doing the Porn Addiction 101 work group, but wondering if the workaholism, how does that play in? And lots of people, like we just said, go to the next thing, and you get attaboys, or attagirls for, oh, good job. So like workaholism is challenging. Scott has shared, and I love this idea of doing a 3-circle plan across all of the problematic behaviors. If you're working with a CSAT trained therapist, there's an online assessment called a MAWASI, money and work something, I can't remember, but they can give you that. It takes you about 20 minutes. Having that information, you may see some patterns in there that are problematic for you. But if you're asking the question, I kind of go, if you're kind of thinking it might be an issue, it might be an issue.
And I'd also ask this person, do I escape to work because it's what I have to do? Or being in the Men's Porn 101 workshop could be that, I don't know you, but it could be that porn issues are there. I would think so. And was that happening when you were working? So not only am I overworking and all of that, but I'm really watching porn while I'm there too. So instead of putting in 50 hours a week and saying I'm working? Am I putting in 40 hours a week or 35 hours a week? And then the other time I'm watching porn, because a lot of people are caught watching porn in the workplace, and that's sort of their secret place to go and get away from it. Are you working at home where nobody's around, but that's where your home base is? Especially with COVID, there was so much increase that occurred with mental health issues, depression, anxiety, because people were forced to work at home in their basements, in a room, in a whatever, but they would use porn and masturbation to help soothe themselves and to escape. So I would challenge yourself a little bit on how much work are you doing and how much work was there porn? And do you really still need to be working as hard as you have? It's creating problems. Doesn't mean it has to go away, but always, when we talk about couples, therapists, and different things like that, is to see if there can be a collaboration, an agreement, a negotiation between you two as to what can I do and what do I set my calendar up so that there's work time, there's playtime, there's recovery time, there's time for us together, and to find out what you can do with that. So I really advise that. That would help a lot. But good for you being in a Porn 101 workshop. That's a big step.
Yeah. Well, and I was thinking with the 2 years and still bringing it up in fights, and I'm like, is the fight the same fight, happening again and again, which often it is. And if it is, like, rather than just engaging and going, okay, now it's your turn to say this, and then now it's my turn to say this, and and going back and forth,
Right.
doing the same thing that doesn't really, help. How can you have the discussion about, we've talked on lots of webinars. John Taylor has lots of really good practical advice for how to navigate relationships. And it's like, do these 4 things. I love the 20-minute, we're going to talk about things 20 minutes, a couple times a week, set time, from 7 to 7:20, and that's it. And, I'll have my notebook, we'll talk about this, but we're going to have it in a safe place. It's going to be a safe discussion. I'm going to listen to you. I'm not going to be thinking about, well, I have to, I'm not thinking about my response. I'm listening to you. I'm saying, what I hear you saying is, is that right? Yes, that is right. Or no, that's not quite right. Here's this. Great. Well, then you can navigate out of it. If it's just the same patterns over and over again, it's exhausting for both of you. And I don't think it probably brings you to intimacy, which is not about sex, intimacy, which is about connection. As far as the sex stuff, because you're trying to conceive, Dr. Rob talks about this all the time. So I'm just parroting him, but it's like, you're not interested and you're working a lot. And there's the stress of like, oh, we're trying to conceive. Like, that's hard for everybody.
Mm-hmm.
Dr. David talks about sensate focused touch, which is not about having sex. And I know it's hard when you're like, oh, the thermometer says it's the right time. So, I mean, I get all of that. So there's pressure on it, but, can you find some ways to connect in real and meaningful ways so that there's at least some, some interest, at some point, but all of those, those are challenges. And, if one thing gets stirred up, I can see it, it's switching to a fight. And then I'm less interested in sex because like now it's not safe. And, and then she's still angry. And, but part of it, like with it isn't, if she's bringing that stuff up, perhaps a response is, I hear that still hurts you. I'm sorry that my addiction hurt you, and I'm doing what I can. Here's what I'm really doing. Like, I'm here. Great. You're doing the work group. Hopefully you're doing some drop-in groups on sex and relationship healing.com too. Here's what I'm doing. So what's going on for you right now that you don't feel safe, and that this is, if you can just hold the space for her. Eddie Caparucci, and I mentioned this earlier. On this one, sex and relationship healing, you'll see previously recorded webinars. He has some great stuff on relationships and, navigating that space as well. So you may find those helpful too. But I know I'm going with, it's 2 years and you're actually in recovery. I'm going to try to take it from that spot. That's still like, and it's great, but clearly clearly there's still some undercurrents, like too much work or something, where she's not feeling safe, and then that's going to bring up she's triggered, and she's going to haul those things out. And I don't hear that you did like a formal therapeutic disclosure. So working with qualified professionals, her to get support, you to get some practical things. I'm glad you're doing the work group, but that may be helpful to get you through this rough spot.
Exactly. And communication with one another, y'all. Sometimes I tell people, can you imagine just sitting next to one another or lying there in bed and just holding hands? Just that touch, that human touch. And then we always tell people when they're leaving is to make sure there's a check-in process on a daily basis where it's not asking about questions. There's a list of questions you can ask one another, and just to check in and have communication with one another. But the past will come back up. You never forget hurt and pain. Somebody's got to have help around what to do with that, and wondering, are you lying again? Are you not lying again? I don't know. You're at work all the time. So how do I know that you're not acting out? So memories do come back, and they're there. And it may be helpful to do that tune-up type thing with the therapist right now and go through, this is what's going on together, so that y'all can learn. You might be at the next step to be able to do some work with one another.
So the next question, I struggle with not making any major decisions for the first 6 months to a year. Recommendation: the person I thought I knew all these years seems like a lie. How could I ever love this person? I feel like I don't even know. Obviously you want marriage to work, but realistically, how often do marriages work after sex addiction?
I'll answer this with it depends. If someone is working with, and again, you're going to hear us say it over and over again, if you're working with CSAT therapists or a therapist that is trained in doing a disclosure process, the client or the person acting out needs to be able to be taught how to put all this information together, and the hurt partner or spouse needs to be prepared to receive that information. So each person has support and things like that. Have I seen marriages work out? I know one right now that they stayed separated for 1 year while this one person was working. They were both working with therapists, and then got back together at the end of that time because they needed to do that work. So I never put a time limit on it. It's how dedicated is somebody that's been acting out? How dedicated are they to recovery? How dedicated is the person that got hurt to finding peace and recovery within themselves? But yes, do we see a lot of people stay together? I think we see many stay together, Tami.
Most do, not without bumps, and it takes work. But I was talking to somebody else again today, and we talked about a couple that did navigate staying together, got served with divorce papers while in treatment, and they realized that they had a deep and abiding love for each other, and eyes wide open. He really did his work. He really committed to changing. She had good codependent aligned support, and they, eyes wide open, have continued on the journey together,
Right.
rather than separating. So, but it takes the eyes wide, it will never be the naive, and it's not like a naive bad, it's just the naive, this person will never hurt me. That this person can, and you, like, once an addict, always an addict. You can be an addict in recovery or an active addict, and that's the choice. That's really the decision, is which side of the fence do you want to be on,
Right.
So.
And this also too is will I ever? I feel like I don't even know if you want a marriage to work, but realistically, how often do marriages work? Well, how is based off the work that you do, and come to a place of, some people have in-home separations while they're doing their early recovery. And believe me, recovery is a process. First 6 months, it can go up and down and everything else, because you're fighting to continue to be a part of a family or a part of a relationship, and doing your work and seeing a therapist and going to meetings, all these ands go into play. And we always tell everybody that first year is so critical that you stay very connected to people that are in recovery so that you can learn and you can tell somebody when you're upset or something's going on or you got angry or whatever, you have somebody to talk to. And that's key. So the first 6 months are very difficult.
Yeah, yes, and you can make a major decision in the first, I found out, last week and I'm leaving and all of that. But people in recovery that are really working on being better human beings and doing the work, they're pretty amazing people, because they're actually doing the work. They're not just going, I'm good enough, so,
Right.
but only, you get to pick, what's right for you. So, but I would get support from qualified people, good support people, that you can trust to help you see, all aspects of it. So, okay, we've got a couple more questions and we're almost out of time. Spouse is SA 18 months in recovery following he came to treatment with us, CSAT 12-step sponsor, but he reacts with anger and raging when annoyed and cannot seem to get control of his emotional meltdowns. He does really well, but then rages. I'm so angry as a spouse. He's treating me so badly, ready to throw in the towel. I don't blame you. That's abusive. So
That is abuse. And unfortunately, your spouse really needs to work with his therapist on what the anger and the rage is about. Usually we will say under anger is fear, fear of, fear about, fear whatever. And to look at what really is that's underlining this. We have a lot of people that started using and acted out because of anger and raging and things like that. But there's no place that this is okay, and it is abusive. And this person may be in recovery from acting out sexually, but needs to work on the anger and rage and find out what's really going on underneath that. Something you may never have known that occurred in his lifetime.
And I'm sitting here going, what do you need to do when this starts happening? And I would have the conversation when it's not happening. We've shared this on other webinars too. It's like when you are acting out in rage,
Right.
I need to protect myself. It is not safe for me. So I'm going to extricate myself. We can talk about the situation at another time, or I'm going to ask you to leave, or whatever it is that you need. But to me, physical safety, you being in that toxicity, it is not okay and doesn't feel at all safe. It is, and it can be, the conversation can be, what do you need to do in order to manage your rage? Do you need to go for a walk for 20 minutes? Do you need to go call your sponsor? What do you need to do? And I'll give you that space, and then we can talk about it later. But this, one more overshare, and then I promise we've got one more question I will try. But I had something that came up for me, and I called it the white hot rage. And the only good thing I could do was not be around. I mean, like, I just was like, and I think people would see me, what I used to ride motorcycles. And one time I was like, and somebody came up to me and I just kind of went this, and she turned and walked away. And I finally figured out what it really was for me. And it was wounds. It was abandonment wounds and hurt and all of that. I mean, I finally figured it out, but I went to my therapist and I was like, this is not working for me. She helped me. I have not had that rage since then, but it was deep wounds, young kid stuff. So there was help for me, and I didn't have to feel that. And I also didn't have to, to act out or hurt myself or anybody else. But like, it was painful for me, but fortunately I learned to contain myself. But I'm sure there was smoke coming out of my, I mean, it was bad. It was
One
hurt.
last thing is whoever is sending this one in, your husband was in Sila. We talk about rage, we talk about anger, we talk about abuse a lot. I would really hope that his CSAT knows that these behaviors are occurring, because it could be warning signs for things. And working with the CSAT doesn't mean that they're told everything. Or any therapist, people can leave some stuff out. Oh yeah, I'm doing fine. I'm doing all my meetings. I'm doing this. I'm doing that. I would wonder if the person's therapist really knows this behavior is occurring, and encourage him to make sure he tells the therapist, what's going on with him. He can share it with her or him.
Yeah, and this might be a great time for you to join one of the sessions and talk about it, or to have a conjoint session with your therapist and his CSAT. But if he really, I mean, I would hope that he wants to be, living in integrity, and that is not. So invite him if he's not already joining the alumni groups. We've got 2 of them every week that meet free for the alumni. That would be a great place for him to go and talk about that too. So, okay, last question. My husband, 35 years, was highly addicted to porn for 15 plus years. Our story is way too long. But according to him, it related to his physical condition of premature ejaculation, which made it impossible for him to give me pleasure I needed and never had. He said he was watching the porn because he was obsessed with watching to try to learn how to be better for me. We've heard that before. I've heard that before. I want to learn things.
Do you see this face?
I know. I was like, yeah, that sounds like a really good excuse. 2 years ago, I asked him to move out, but he is always trying to get me to come back and trust him. He says he says his lips are moving. He's no longer addicted since he started taking Roman. I don't even know what that is, but I'm sure it's something. He apparently is now able to satisfy the woman he's been with since he moved out. He said he thinks he's finally able to perform, cured him of being engrossed in porn. Since our separation, he seems to be obsessed with buying Bitcoin, Coinbase, blah, blah, blah. He says that these are investments, but I wonder if it's an under the radar way for things he doesn't want to know about. Can you please share your thoughts?
Well, one, I'd look at another addiction that's there.
Yeah.
Right. When we talk about the financial side that's going on. And I'm reading all through this going, I have to challenge and wonder if this person's in recovery.
Oh, he's not. He didn't need recovery because he found Roman, and so now he can perform with this woman. So he didn't do anything for any kind of recovery. He just stopped the porn, but switched to the Bitcoin, etc. But now he's magically able to. He found the magic cure is Roman. I'm saying this highly sarcastically, so please do not go order this online. So to me, you know what I read? I'm glad that you are no longer with him. I wish you joy and happiness in finding a partner who is really able to step into the relationship, because 35 years he's blamed not being able to pleasure you. Yeah.
So I can't pleasure you, so I'll just go out and find other women so that I can sort of practice and pleasure you.
But I'm going to watch videos for hours or whatever. Right. I'm going to watch porn for years, and I didn't learn enough, but then Roman fixed it. So now he can do, is somebody in denial. Oh, it's a medication like Viagra. So, okay. Thank you. I learned my new thing for tonight.
Tami, and my radar is up on this one. Yeah. So, I'm glad that you're safe and fine, and also he needs help.
Yeah, and I'm sorry, and he just looks like I'm chasing. I mean the Bitcoin stuff, and I'm not making any judgments again, but like that stuff is traders, highly addictive. Gaming, gambling, which that's day trading and all of that is very high dopamine levels. Very high risk. So, yeah.
Okay, Ms. Tami.
Well, I just want one more thing. 2 years ago, I asked him to move out. So what is your plan? Because his lips moving and saying, come back and trust me. Like, no, either I would encourage you, if you're okay with the in-between, great. But if you're not, what is the plan? What are you each doing to navigate either coming back together or separating? And for this one, I'm going to say Dr. Rob does a one-time 2-hour expert consultation. And that's what I'm reading all over this is, having somebody of his caliber, does it via Zoom, having someone who's really able to help figure out what the issues are. Mm-hmm. One-time 2-hour consultation. It's not weekly therapy, but maybe really helpful for you to gauge what's going on, and him too. So
right.
Reach out to me, Tami at seekingintegrity.com, TAMI, if you have questions about any of that. But thank you all for joining us. Karen, thank you. I I so appreciate, I know you had a full day, so I appreciate you
I
hanging in
love
there
it. I
and being
love
with
it.
me tonight. So
And
we'll
I
do
love,
ladies night
I love-
again.
we will. We like ladies' night. And to all those people out there we know, hi.
Bye. Bye, everybody.
Bye.